much, konnichiwa, and thank you to the committee for allowing me to speak today. So I'm going to talk briefly about a research project that we finished last year. So it's a follow-on piece of work looking at trying to compare different treatment protocols for early detected calf pneumonia or BRD, as it's more commonly known. And this project really circles or centres around the use of early detection methods with TempVerified fever tags. So you can see that pictured in the calves there on the screen there. So I'll touch on how they work a bit more in a minute. So we know that BRD and calf pneumonia is probably the second largest calf disease following on from scour, with a mix of prevalence reports in the literature. In the UK, we reckon about 47% of dairy calves are affected, and similarly, a similar number in the beef sector as well. The greatest risk period being between about 2 weeks of age and up to 6 months, so in the post-weaning period. And we know that there are established economic costs, both short-term, so looking at the cost of drugs, mortality rates, and the time put into these sick calves, but also the longer-term effects, so effects in growth rates, productivity when they calve down as heifers. And we're looking in the UK at about £43 per calf as a rough estimate. So we know really from the literature that to be able to treat BRD effectively, we need to be able to detect these calves in a timely manner, be accurate, and then treat them with an appropriate therapeutic intervention. But often I think we come to the party very late as vets, and a lot of the damage and the pathology has already occurred in that lung. We know that visual observation and detection is patchy at best. So in a nice study by Savula, we've got about 56% sensitivity of farmers for detecting BRD accurately. And I think sometimes as vets, we're also very poor at detecting early signs of BRD, and in many cases we get called too late to the very clinically depressed and collapsed calf that we really can't do too much with. In terms of being able to detect BRD very early, some really good work using reticular room and temperature boluses has shown that pyrexia really is one of the first pathological, physiological changes that happens. So at about 19 hours after you get pyrexia, you'll start to see nasal discharge, and then about 65 hours after that, we'll start to see coughing. So pyrexia really is our kind of flagship alarm bell for detecting BRD. So working on those lines, we often have to treat what's termed as a bit of an undifferentiated pyrexia because we don't have those classical clinical signs to go on. So our aim is really to try and introduce therapy very early in the disease course, and that will help to reduce morbidity and increase our treatment efficacy. So as I mentioned, we've got this new technology. We've got the fever tag. So this piece of technology has come out of the feedlots from Texas. It's an external ear canal temperature monitoring system. So the body of the tag sits in the ear just like a normal ID tag. And then the external temperature probe is put into the external ear canal, the auditory meatus. It monitors body temperature every 15 seconds. And then once the temperature remains above 39.7 degrees centigrade for a sustained period of 6 hours, we get a flashing LED light. So this just demonstrates where the probe sits in the external auditory meatus. And this is a picture of a calf with a flashing light. So it's very obvious and very visual, making it nice and easy to enable usage on farm with minimal training. So I'd done some previous work trying to compare non-steroidal and antimicrobial therapies for treating BRD. So in the first trial, we gave half the calves non-steroidal when they became pyrexic and half the calves antimicrobial. And we compared basically the recurrence of pyrexia. So did pyrexia or BRD resolve, or did it continue? And in that study, we found that calves that received non-steroidal as the first-line treatment were 5 times more likely to require a second treatment, i.e. they remained pyrexic, and we went on to give them an antimicrobial. However, 25% of those calves that had non-steroidal did self-resolve their pyrexia, so they didn't go on to develop clinical BRD. So we wanted to build on this trial, try and make it a bit more robust. So we used a control group in the trial I'm talking about now. So these were calves that we just monitored for 48 hours after the pyrexia was detected to see, was pyrexia a good way of detecting BRD, as had been shown by the reticular rumen temperature boluses. We tried to make it robust by using the Wisconsin calf scoring clinical sign data collection to see if, when they were pyrexic, there were or were not clinical signs. And then we also did some pathogen diagnostics to try and find out what was going on farm. So we enrolled one farm from the UK, from Dorset, which is in the south of England. It's an all-year-round calving farm, approximately 300 cows. This is a photo of the calf shed, so in pens of about 20, mixed sex, fed an automatic calf feeder. And then the farmer involved was trained to give a brief physical exam to rule out other obvious causes of pyrexia. So we're talking about this diagnosis of exclusion. We had 4 treatment groups. So in group 1, the cows received a non-steroidal when they became pyrexic. In group 2, they received the antimicrobial. In group 3, we gave them a combination of the treatments. And in group 4, we monitored those calves as a small kind of negative control group just to see what would happen. So the drugs we used were flunixin and gamethromycin as our antimicrobial. This is just an overview of the Wisconsin calf score. So at the point at which pyrexia was detected, so the fever tag was flashing, the calves were Wisconsin calf scored to see if there were any signs of clinical disease. So the results really echo that of the first trial. So prevalence on this farm, so this is a prevalence as detected by fever tag, so the presence of pyrexia for a sustained period of time was quite high, so just shy of 60%. This mirrors that found in the first trial, which was run on 2 farms in the UK. So although this is a subclinical BRD, it does show the very high prevalence that can be circulating on farm. And I think realistically, if we're waiting for clinical signs, that would probably drop down to the reported 47 to 50% in the literature. We found in the control group, so the calves that we monitored for 48 hours, that 76% of those calves remained pyrexic. So this kind of backs up the work showing that pyrexia really is a good way to detect BRD very early. We found the mean age of onset of this pyrexia was about 29 days old. And interestingly, in our study, there was no difference in growth rates between any of the 4 groups. And I think this pays dividends to the fact that we were intervening at such an early stage. We used some deep nasopharyngeal swabs and paired serology to try and get a handle on the pathogens involved. The only things we really found was an increasing or rising titer for coronavirus. We didn't do any bacterial testing, but these results kind of led me to believe that bacterial pathogens were probably involved, so your Mannheimias and your Pastorellas, potentially due to stress, mixing, that kind of thing. So we did some statistics, so some multivariable binary logistic regression, and really the key points here are the first column. So this showed that the calves that received the antimicrobial as the first-line treatment when they became pyrexic were much likely to go on to have repeat bouts of pneumonia or pyrexia caused by BRD. And the calves that did receive non-steroidal as the first-line treatment were more likely to have recurrent BRD. So this, again, mirrors what we found in the first study, that the antimicrobial, in this case, on this farm, did seem to be much more efficacious in preventing and resolving that pyrexia due to BRD. We looked at the clinical scores, so the Wisconsin calf score results at the time of pyrexia detection. And again, we essentially had very low numbers of clinical signs detected. There was nothing significant in the results, but this probably mirrors the fact that very few calves had clinical signs at the point of pyrexia detection, which again mirrors previous literature. So these two studies together, I think, show quite nicely the high prevalence of BRD on our farms. It really is a big issue with many things contributing, not only the pathogens involved, but also the environment, the housing, the nutrition, the colostrum, all those kinds of things. I think it shows pyrexia is a very good, quite robust way of detecting BRD at an early stage. And really our results do show that the antimicrobials as a first-line treatment have been the most successful within this trial. It might not be applicable across all farms, but in the subset that we've looked at, it certainly has been. The non-steroidal did allow about 32% of calves to self-resolve, but it then put them at an increased risk of repeat cases of BRD. So potentially any short-term reductions in antimicrobials potentially led to longer-term increases in usage. So from this, we kind of came up with our SOP for use on farms. So pyrexia is definitely a suitable way to detect BRD. And with using the early detection method that the fever tag provides, we've decided we're going to use our antimicrobial. I still like to use it with a non-steroidal, even though there was no significant improvement. But I think there are potentially other benefits, so a combined antimicrobial and non-steroidal approach for treatment. So I'd like to say thank you very much to everyone involved, to fever tags, and to John Baggs, who's the farmer involved. I'd like to take any questions.
Thank you, Dr.